we get a lot of people who come in for a preconception advice. And the question always is that what do we need to do, right? What do we need to do if we are planning for a pregnancy? And are there any tests that are required before we plan for a pregnancy? Now, like I said, what do you need to do is basically a couple of things. Maintain a good diet, exercise, that is, make sure that the lifestyle is good both for the male as well as female. If there is obesity or if the weight is very low, make sure that the BMI comes to normal before you try and plan for a pregnancy. Diet, exercise, like I said, in diet, if we have we've had many FB lives and talks just related to diet. But just to elaborate, when we talk about diet, we are talking about taking in a lot of green leafy vegetables, plenty of fruits. The more colored they are, the better. Avocados, plenty of water, dry fruits, hazelnuts, all these things are going to olive oil, soya bean, all these will help the fertility. Celery, these are similar for male and female. Again, like I said, some kind of exercise, taking your prenatal vitamins, that is folic acid, is very important, and planning intercourse around the fertile period of the menstrual cycle. So planning intercourse when the egg is about to ovulate. Again, there is one more thing that a lot of people do nowadays is checking their ovulation times with apps or LH kits. And I know a lot of apps are available and you can definitely use them. But I have also seen a lot of couple come in with a lot of stress when they are using these apps, because there is that performance anxiety that, oh my God, if I miss this date, then I'll land up in a problem. It usually also causes a lot of stress to the male partner, because it may not always be easy to just say that, on this particular day you have to have intercourse. So it becomes a little stressful. The second thing is, with LH kits, sometimes you don't get the correct determination of ovulation, so you may actually miss your ovulation instead of actually timing it correct. So generally what we advise is, make sure to have intercourse during the middle half of your menstrual cycle, like from the 10th day to the 20th day. You can have intercourse every alternate day, not more frequently than 24 hours and not less frequently than 48 hours. And this should be enough to cover the ovulation period and have sperms there in the reproductive tract, even if the ovulation happens a day or two here and there, if the intercourse has happened. Lastly, are there any investigations or tests that couples should do? There is no need to test for fertility, right? When one has just started planning for a pregnancy, it is not mandatory to check certain fertility tests, but making sure that this woman has, her sugars are normal, her thyroid is normal, the infectious disease screen is normal, so that, nothing is passed down to the baby. She's immune to rubella. There is no thalassemia trait. Her vitamins are normal. These are important things for the maintenance of health of the mother as well as the baby. So these are certain tests that women should do when they are planning for a pregnancy. They should take their folic acid supplements. They should have a good lifestyle and plan the pregnancy and intercourse at the right time during the menstrual cycle.